everybody, and welcome. I'm Polly Dawkins, Executive Director of the Davis Phinney Foundation, and this is one of 3 additions we have planned to our Care Partner Training Program. You can access the entire training program at the link at our signature below. In today's session, Dr. Jori Fleisher will share some of the tips and tricks you can use as a care partner to help improve your quality of life. These tips and tricks are really focused on ways that you can help your person with Parkinson's. The goal of this presentation is not limited to that. We hope that this will help you learn some new techniques and strategies to take some of the pressure off of you. To get us started, Dr. Jori Fleisher, welcome back.
Hi, thanks so much for having me, Polly.
It's great to see you again. For those of you who are new to the Care Partner Training series or have never seen Dr. Jori Fleisher speaking or know what her background is, Jori, would you tell folks who are watching a little bit about your background and why this work means so much to you?
Sure. So I am a movement disorders neurologist, which means I spend all day, every day taking care of people living with Parkinson's and their family members and Parkinson's related disorders. So I am based out of Rush University in Chicago, and I lead our Parkinson Center of Excellence and also our Lewy Body Center. So I see a lot of folks, and particularly my research and my clinical interest is as things get a little bit more complicated, as strain gets a little bit more difficult on our care partners and our families, our system just isn't designed the way that any of us would want it to be to provide all the support that people need. And so, how can we, as a team, right, bringing in all of the different healthcare professionals and disciplines who have so much to offer, how do we pull in all that knowledge and find those tips and tricks and resources and supports that help people thrive together, whether they're a person living with Parkinson's, a care partner, family member, however they identify.
Thank you for this work and the passion that you have for our community. It shows.
They're my people.
You use that word strain, and before we jump into this the slide presentation that you have, can you tell us why you choose to use the word strain, care partner strain, or caregiver strain, as opposed to burden, which I know some people lean on that word?
It's a great question, Polly. And I think sometimes they're used interchangeably. We have different scales and instruments in a research context that we might use to measure strain versus burden. And honestly, I'll say when I see the definitions, definitions often seem fairly interchangeable. I think, strain or burden could be thought of the perception of or the mismatch of what is being demanded and what the person feels that they're able to handle. Right? And so that's different from every person, right? Every situation, a care partner might have a loved one who has really mild symptoms, but that care partner or family member may be juggling caring for young children and working full time and doing all kinds of stuff. And so that mismatch, the strain on them may be really high, even though, the Parkinson's might be really mild, right? Whereas someone else might have a loved one with really complex needs and a lot of difficult symptoms, but have lots of support or have a lot of knowledge. And so they might perceive their strain to be quite different. And so I think it's something that's very subjective. We can't look from the outside and go, "Oh, this person's really facing a lot." We might think that they are, but they internally may feel that self-efficacy, the mastery of, "I got this," or "I know where to go or who to ask for help to help me get this."
Thanks for that. That's helpful. Helpful to understand. All right. To start today, I want to note that the inspiration for this presentation came from conversations you and I have had, but also from all of you in the audience, from you care partners, and that you've given us a sense of what you need to care for your person with Parkinson's. And so that's the inspiration for, and you've collected this all of these ideas, Jori, from your work in the clinic, right? And out in the field.
Yep, it is a potpourri of things that usually follow with, "Oh, you need to check this out," from people with Parkinson's, from care partners, of random things. So I always say, anytime I give a talk like this to a support group or anyone else, I'm like, full disclosure, I have no affiliation with any of the products or the companies or Amazon or anything like that where you can find some of these things. They're literally things that, people have shown me and have gone, oh, that's brilliant. I need to tell other people about this. So,
Yeah.
bring it on, share. If you have things, tell your healthcare providers, tell your loved ones' healthcare providers, and disseminate that info.
Yeah, and tell us at the Davis Phinney Foundation because we can also compile those and add more tips and tricks to this um, the wealth of information that we can share. Before we jump in, we hear, and I hear from this from our people who attend our care partner meetups and people who write to us that oftentimes as a care partner, you lose your sense of who you are, the sense of a sense of self, your who you are in the world because you're giving so much into this caring role. And some of what you've compiled for us here today, Jori, seems to be ways to maybe gain back a little bit of that space for yourself. Can you talk a little bit about some of your inspiration or why this is important to navigate this well?
Absolutely. I mean, I think what I hear so often from people with Parkinson's is they don't want to lose their independence to do so many things, right? And on the flip side, our care partners want to facilitate that independence. They want their loved ones to be able to do everything that they want to do. And they also may be concerned, right? Or may see changes and think, they can't do it the way that they used to, or it's no longer safe to do it the way that they used to. And sometimes it can feel like it's either, it's very black and white. They're able to do this on their own, or they cannot do this and I have to do everything for them. And there's gray in between there. And I think so many of these gizmos and gadgets and, silly little tricks are things that reorient us from, being in that black and white to being in the gray. How do we empower a person with Parkinson's who may no longer be able to open the jar the way that they used to, right? Instead of you as the care partner now having to open every jar, right? Maybe there's something in between there. And that's just a tiny, silly example,
Yeah.
but a lot of things like that. And I think, to your point, Polly, is our care partners often kind of lose their identity beyond, that caring role. And that is so important. And it's an invaluable, amazing role. And you were someone, a whole someone, before you took on this role. You will be someone always during and after, right? And so not losing that sense of who you are is really, really important. And being able to offload some of the things that we might otherwise just fully absorb and take on and take on and take on, never hand anything else off. It's really important because otherwise that's when I see care partners really kind of lose. Well, I used to do this and I used to have this hobby and I had this group of friends, but I kind of lost touch and I don't even know how to restore those relationships. I don't want anyone losing those relationships in the first place. So leaning on community resources, leaning on foundation resources, and just these silly day-to-day things. And if some of them work for you, awesome. And if some of them you look at it and you're like, there is no way, that is fine, right? No, take what's helpful, leave what's not. This journey is so individual.
Great. Well, let's hop into some of these things that you've discovered. I'm going to share my screen here and I'm going to run the slides and let you run through the presentation. How does that sound?
That sounds great, Polly.
Super.
Thanks so much. So we thought that we would start talking about some communication tools, right? Before you can do anything else and find something else, you really need to know what your loved one may be asking for or talking about and how you can best, understand and serve that need. We also know that communication can really change with Parkinson's. And so we want to find as many ways as possible to help. So a couple of things, your loved one's neurologist may ask, one of the hallmark symptoms of Parkinson's is tiny handwriting that gets cramped or small. And it's not something that for many people, they may not do a lot of writing. But for folks who do, that can be really challenging. And so a couple of easy things. Number one is we're filming this in January. We just got through the holidays, but this first suggestion on the farthest left is one of these little stamps. That's a signature stamp. For many people, their signature changes And it can be really frustrating and really, really difficult, especially if we're coming up to writing holiday cards or sometime else when someone might need to change things, signing tax forms, right? So instead of that frustration, people can actually go to their local copy store, office store, and you can practice and come up with the perfect signature that looks as close to a real signature, your old signature as possible, and have it turned into one of these stamps. And then it's just a quick little kachunka on anything, and you can make your way through all the cards, through tax documents, whatever you need. And if your signature is something that is part of your identity, that's maintained for your loved one. And you don't need to sign for them as their care partner or make an X. They can sign on their own. For some people who are, actively doing a lot of typing can be really challenging. This is just one example. Dragon is one company that makes dictation software. There are a ton out there. None of them are perfect. And depending on a person's voice, their volume, if they have a really low voice because of Parkinson's, it may take time to train your Dragon or to train the software to hear and translate that and say, oh, wait, that's not actually what I was saying. I was trying to say this. But for someone who does a lot of writing or typing, this can be time that's really well spent. So that can be really helpful. And the other is I had a very dear person with Parkinson's who actually came to diagnosis because he worked a lot with computers and kept finding that, his IT department just kept giving him these faulty mice because no matter what was going on, it just kept breaking. And all these weird things were happening with his computer. And he would take out the batteries and do all this stuff. And finally, he realized that, on his third or fourth mouse, that it turned out that was how he came to Parkinson's knowledge was because he actually had a resting tremor that he really wasn't aware of. And that resting tremor was just enough that it was activating the button on his mouse. And so he built himself with a drill and a little paper clip. He made himself a little finger rest just above his mouse so that if he wanted to depress the button, he had to sort of do it intentionally, but otherwise it was caught, right? This doesn't apply to everyone, but I love it as this example of ingenuity and really simple life hacks that if there's something that a person with Parkinson's feels like is really tripping them up, you can hack something. You can try and build it to work for them, for you. So be creative.
Let's talk about some more communication tools.
Yeah. So another thing, especially with, tremor, is I have a lot of people that find on their smartphones that they get into trouble with double taps. And so this, depending on when we're watching it, this may be out of date because at least this is taken from an iPhone. The updates always change things and try to make them better. But if your loved one has Parkinson's and is struggling to manipulate their iPhone, you can go to the settings menu. And from there, you go to accessibility, which you've highlighted. And in the accessibility menu, look for the touch setting. And then from there, we can go over to the next slide. There is a field called touch accommodations. And if you turn that on, then all of the other stuff below it will activate for you to be able to change that. And so you can change the hold duration, which means you have to really intentionally, kind of like the mouse and the finger, you have to really mean it when you tap on something for the phone to recognize, okay, yes, this person's actually trying to do something. And you can change the repeat settings. So if you have a tremor and you accidentally tap multiple times, you can tell it, stop doing that. If something is tapped in rapid sequence, just ignore it. So this can be really helpful. There are similar things for Android devices. I'm just not as familiar, but Google will help you with those things.
That's great. Thank you.
Something else, and this can be a challenge for folks in late stages of the disorder or for some of our Parkinson related disorders. But sometimes people have a lot of trouble getting the words out at all. And there are a bunch of different communication devices out there, but this is a really simple thing that we can steal from another purpose. These are books that are designed for travelers to a country where they don't speak the language at all. And it's literally a picture dictionary that can be used to say, as shown on here, I would like the chicken, or beer, please, or where is the bus, please. These are different. If you look up tourist picture dictionaries or by these names, there are lots of examples. If someone is struggling to get their words out, you may find that one of these is helpful to just keep in a back pocket, keep around at a place where you might be having a conversation and someone struggles with word finding.
Great idea.
And then kind of a similar version of that people can personalize, especially if getting words out is really a struggle. If you search on your favorite browser for communication board, you can find all kinds of different things that have common phrases that people might want. So someone could point to yes, no, thank you, please. You can make these on your own as well. So you can tailor these to, culturally appropriate things that are important to your loved one. You can put names, I want to call so and so, so and so. And so these can be really simple things. I've had people laminate these and keep them in various different places throughout the house or in the car.
Great idea.
And then a different version of that, slightly higher tech. There are lots of different apps out there that function in this similar way. This is just one example. So it's called Small Talk. You can find it on the App Store, but you can choose the voice. So you can choose a male or female or various different sounding voices, different accents. You can feel fancy. But there are some very common conversational phrases. And so this can let the person with Parkinson's who's struggling to get their voice out, they can control it and it will speak it out loud. So instead of them pointing to something on a board and you as a care partner maybe having to say, oh, they like the chicken, right? Then they may be able to say, this, please, where's the bathroom? Help me with this. So it's a bit more empowering. And future directions, what's really exciting is Polly and I were just talking about AI, artificial intelligence, being incorporated in Zoom, being incorporated all kinds of things. There's some amazing work out there because I think many of us can recall hearing Stephen Hawking, for example, trying to communicate and having that, kind of very stereotyped computer sounding voice. And better than not being able to get thoughts out at all, certainly, but it certainly is different than hearing one's own voice. And so Representative Jennifer Wexton, if people aren't familiar, is a congressional representative out of Virginia, I believe, and she has a related disorder, PSP. And because she's given so many talks on the floor of Congress and she's a public figure, there's enough recordings of her voice out there that an artificial intelligence company said, can we build a model where you could type in what you want to say and it's your own voice projected out saying it. And she actually was able to deliver a speech on the floor of Congress that she had written using her own voice through this AI voice model. So is this ready for prime time yet? Not quite yet. But people are working on this and hopefully will use their powers for good so that if someone has lost their voice because of a neurologic disorder, there may be ways to kind of regain and recapture it.
That's exciting. That's
It's
exciting.
really cool.
All right, let's move topics and talk about mobility, transfers, and the reason I remember this being an important topic, Jori, is in our last one of our sessions that we did together last year or the year before that, really highlighted the physical impact of caring on the carer, on the caregiver or care partner, and you. Why don't you describe like what can caring do to a care partner's body?
Our Parkinson's care partners have higher rates of back pain and strain and injuries, right? Because there's a lot more mobility that can be impacted in someone with Parkinson's. And so as a care partner, you may be many times a day helping that person to stand up, maybe just helping to bear some of that weight, or you may be bearing a lot of that weight. You might be, walking alongside them and they stumble and you go to catch them and pick up that person. And that can be a tremendous strain. So we know people have higher rates of arthritis and joint issues. And if you are injured, right, then you can't care for your loved one, in the same way. And so we want to make sure our care partners know the best ways to help with transfers and mobility, not just for your loved one's well-being, but for yours too.
Jump into some of these ideas that you've come up with or heard about.
Yeah, so this was one of my earliest recollections in fellowship was one of my attendings going, all right, time for plastic bag trick. And I was like, what is a plastic bag trick? And this is all of us, probably. I, under my desk, right, just randomly today, brought something in one of those throwaway plastic shopping bags. Not good for the environment. all of us have them stuffed somewhere, right? Keep one in a car, in a glove compartment. Keep one in a handbag or a pocketbook if you carry that with you. And if your loved one is going to sit down into a seat in a car, or even sitting into, a deep sofa, or a chair that's really set back, pop that little, it can be torn, doesn't matter. Pop that raggedy plastic shopping bag down before they sit down, just under their butt. And then when they sit down, it makes it easier to slide and scoot, and it takes away some of the friction, and it's just easier to get in and out and pivot. It is cheap. Most of us have them lying around. You can have a bunch of them. It does not matter. It's really helpful, really simple. And if you feel like being fancy, you can get the fancier paid for version. There are actually, I think of these as sort of lazy Susans or lazy Stevens, for people. And they're little swivel seats that can be purchased and put on a car seat. They can be put in a sofa. They could be put in an office chair if someone has a particular chair that they really like to sit in but struggles to get out of. And it just means that they don't have to do as much work to pivot. It will pivot for them. So that can be kind of nice. And this is so brilliant. So this is like the peak combo for traveling in a car. So as a care partner, I've often seen a lot of our folks, helping their loved one get into the car. And because Parkinson's can really cause a lot of tightness in the shoulders and the rotator cuffs, it can be really hard for someone with Parkinson's to reach over, buckle their seatbelt, or reach and pull it. And so the care partner is often doing that. And either they're sitting in the driver's seat next to them and trying to reach over, or they're standing outside of the car, possibly in the cold or the rain, bending over, causing back strain, doing all kinds of gymnastics, and it's really difficult. Um, if you search for seat belt extender, which you see on the left side of this, it is literally just you want the hard plastic one that just basically plugs into the seat belt that you've got, pops it up a little bit higher. It saves you about 6 inches of reaching and bending. And even though that's not huge, it makes a big difference. You just need to make sure, because if you search for seatbelt extender, there's this kind of hard plastic thing. There's also just sort of an extension to the belt for folks who have a larger body size. And that may or may not be helpful, but this is the kind of thing that we're talking about in the car. And then if you combine that seatbelt extender and you put a plastic bag under their behind, and then you look for this car assist handle. This was one of these first hacks that someone told me about. And I was like, what is it? And if you look online, it's sort of marketed as like a MacGyver type thing. If you drive into floodwaters and the car is, stuck and whatever, that pointy end, you can use that actually to bash out the glass of the window. And underneath in the little white part that you see, there's actually a little razor blade hiding under there, so that you could, rip yourself out of your seatbelt if you needed to. That is all well and good. We hope no one ever has to use those features. What this is really useful for is you can see that this person has wedged the metal part into the latch on the side of the door. So every door, that's how a door locks, that little black part that it's wedged into, you can put this in there, and it is a solid metal lever. So it gives people leverage to hold on to, pivot themselves in and out of that seat. You take it out, you pop it in the central console or in the glove compartment, you take it with you wherever you go. I think they're about $10. Really useful. Just the same way that people can have trouble maneuvering in and out of a car seat or a sofa, we see a lot of the same things in bed. And so the other, the version of the car MacGyver handle, are called bed canes. This is different than like a bed rail, which would go the full length. But instead, a bed cane depends on the type of bed you have, depends on whether you've got a box spring in your mattress. I am not aware of any that will work for a waterbed. Waterbeds are probably not a great match for someone with Parkinson's. I'll just put that out there. I've had people ask that question. I'm like, that is one that I don't know how to solve. If there's an occupational therapist out there who knows how to solve that problem, they're worth their weight in gold. But different things that will wedge underneath the bed and then give you that leverage to be able to hold on to and sit up, pull up, maneuver in and out of bed. And this way, the person with Parkinson's is better able to do that on their own and doesn't require as much lifting or assistance from the care partner and lead to as much strain. And the flip side of that also is Similar to the plastic bag trick in the car, plastic bag trick in bed is silk or satin pajamas or or silk or satin sheets. Okay?
Not
Um,
both.
not both, because both is the Parkinson slip and slide. And I have had care partners who were overzealous and they're like, oh, Jori, you said we should do this or that. We did both. I'm like, no, 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 because both together is not enough friction. And that is a recipe for someone falling out of bed. So pick one or the other, or you can buy both. Just don't combine them at the same time. Silk sheets, cotton pajamas, vice versa. So, um, and this is less of an issue for most people with Parkinson's and may only become an issue for some folks in later stages. But sometimes it can be really difficult, even with those kind of simpler solutions, to get up to go from a seated to a standing position. There are some different sit to stand devices. They kind of go behind you, and it's sort of hard to demonstrate on there, but basically the bottom piece that that person is sitting on, the black piece, actually opens up. And so it kind of acts like tongs behind the person and kind of can scoop underneath them. They just have to kind of sit up a little bit, sit back down, rest on there. And then that device can be used to kind of help move them from a seated position to a standing position, or to kind of transfer, for example, for some folks from a seated position maybe to a commode or to the toilet. Insurance does not cover these, unfortunately, but there are some lending closets out there that may have them, so it's certainly worth calling. And kind of related to that is for folks who really are unable to transfer on their own, and may not be able to even, put the little bit of bearing weight that a sit to stand device may need. There are things called a Hoyer lift, and this is really a device. They can be electronic, they may be electric, they may just be totally crank. So helps a little bit with back strain, but not entirely. But these kind of are a sling that can go under the person who has trouble moving and lift them out of bed, out of a chair, and then be able to move them from one place to another. This is not something that most people with Parkinson's ever wind up needing. But we bring it up here not to scare people or to say, oh my gosh, I need to start looking for a Hoyer lift, but to know that if you are ever in that situation, there are solutions that exist. Um, for this, insurance may cover it, but they do take up a lot of space. So if you're in a really cramped, tight space, a Hoyer lift may not be the best fit. But again, check out your local lending closet because they may have them to test. And then, so sometimes if folks are, walking, they're able to walk with Parkinson's, but they may be a little bit unsteady. They may have a tendency to veer or to stumble or to fall. We want to be able to catch them if possible without you as the care partner going down with them or holding them in a way that could hurt the person with Parkinson's or hurt you. And I see a lot of that. Um, if your loved one's ever been in the hospital, or if you've ever been recovering from surgery and they've gotten you up and they've used a gait belt in the hospital, often these are like, I don't know, they're these beige with metal clamp kind of things. They just wrap them around your waist or your chest. You have to kind of weave it in and out. I still haven't figured out really how to use them. They can be really challenging to use. Thankfully, there are some better versions that actually clip together with a regular sort of buckle that makes it easier. They're made out of a washable fabric instead of something that gets stinky and gross. And what I really like about some of these newer ones is you can get them in different colors and sizes. You should size it to your person. But these bright green handles that you see here are really helpful, and they're strategically placed direction wise and where they are so that if someone is tipping, there's the best chance of a person nearby being able to grab them and hold that person up without also injuring yourself. So using a gait belt rather than trying to catch someone under their armpits, for example, is much safer. And a lot of these are waterproof, so you can use them in the shower.
Oh, great.
Yeah.
Good idea.
And I think just, thinking about mobility is sometimes as time goes on, people may do a lot more sitting. They may be less mobile on their feet, and just sitting in place. And we do worry, especially if someone is losing weight, that they lose a lot of cushion, and that puts people with Parkinson's at risk of developing pressure sores or skin wounds. And so we want to make sure that they're cushioned, especially in places where the bones may be close to the surface of the skin. And so that's kind of at the sacrum and the sits bones. So there are all kinds of different cushy pillows out there. It could be memory foam, it could be gel. Pick and choose. There's no one right answer. But we just don't want people sitting in exactly the same place for, hours at a time. They should be moving, changing positions so that pressure is shifting, and different pillows can help with that. Um, and often, so I'm seeing patients in a clinic, and our parking garage is basically like a 2-block walk from our clinic, which is not ideal. And so a lot of times folks are coming in using a wheelchair just to get to me, even though they don't use it on their day-to-day basis. And so a transport wheelchair is really what's ideal for that. So this is easy to fold up, easy, not super easy, but relatively easy to fold up, collapse, put into the trunk of a car, put on a bus for short distances or trips. You can see that the seat does not look particularly cushy. It's really just kind of a thin flap of fabric. This is never meant to be used for someone to use on a daily basis all day long, or to be their primary wheelchair. And so I want to bring your attention to our US-based folks. Here is dumb Medicare rule number 1, which is that Medicare in the US will pay for 1 wheelchair for a person every 5 years, or 1 walker for a person every 5 years. You could get a walker, and then you could get a wheelchair within the same 5-year time span, but you can't go the other way around. And transport chairs are relatively inexpensive compared to a wheelchair that might be, needed for everyday use, that has a cushier seat, that has better wheels, that's designed for someone to be using on a more regular basis. And so what we always tell people is, don't use your Medicare benefit for a transport chair, which might be about $100, $150. Look for a lending closet, see if there's someone who has one that you can borrow, rent it. Don't use your benefit for that. Save the benefit for a more specific, better, more expensive chair when you need it. So, and this was such a brilliant trick that someone told me. She said, listen, Jori, I had to push my loved one. They were on a trip, and the hard black plastic grips on there are miserable. They're so difficult on your hands. And if you're pushing someone and they weigh more than you do, they were coming home with calluses. She goes, so I just went to my bike shop, and they took the wheelchair to a bike shop, right? Because Polly can attest to this, right?
Handlebars.
The grips on your handlebars are really important. And so she said, find me grips for these handlebars on the wheelchair that are going to be ergonomic and comfortable and will be okay for outdoor or indoor. And they sliced off those terrible, builder grade grips on the wheelchair, took them off, sprayed some hairspray inside, and then slid on cushy, brightly colored grips, and they were so much better. And she was like, this made all the difference, right? My loved one didn't change their weight. The wheelchair didn't change. Just the grip was enough to make this doable. So really simple, brilliant,
Remember those?
creative things.
You remember those bike grips that kids have that have little sparkly bits coming off the ends of the bike
Oh,
grip?
yeah.
You
Oh,
could
yeah.
do
Add
that.
ribbons if you want. I mean,
Yeah.
glitter it up. So,
I mean, why not?
right? I've seen folks, they walk around and like there's the regular cane, but then there's like the cane that's purple and it's got gems on it, right? No one ever said, hey, I really look forward to being in a wheelchair, right? But if we need it so that we can do the things we want to do and go to the places that we want to do, I think there's something to be said for just saying like, own it, right? If I'm going to use this, I'm going to need this.
Yep,
Don't be
absolutely.
ashamed of it. So.
Great. Let's start talking about another topic, dressing and bathing and other activities of daily living. Such important topics.
Really, really critical. And so, toileting and hygiene and getting dressed can be challenges that I often see our care partners kind of fully taking over. They'll see that their loved one is struggling with tiny buttons or tiny zippers, which is a very classic Parkinson's thing. And so then they're like, oh, I get her dressed every morning. I do all of it. And again, I think there's stuff between that black and white. So these are some suggestions that we've heard of for kind of living in that gray. So especially like this has been an explosion in the last 5 to 10 years, is this idea of adaptive clothing. And it's a really broad term, and this can mean anything from clothing that is easier to put on for someone with a neurologic illness to things like clothing for kids with autism spectrum disorder, where they may be really sensitive to seams and labels, right? And so clothing that doesn't have seams and labels in places that will rub. But for the purpose of someone with Parkinson's, avoiding things that have tiny little buttons, especially like the buttons on cuffs, for button-down shirts, buttons, down the front, really difficult. And people don't necessarily want to wear stuff that looks different. They want to wear their usual clothing. So Amazon, Target, even Costco online for a while, I was seeing if you typed in adaptive clothing, they had, for example, polo shirts, golf shirts for men that look like their regular golf shirts. But instead of having to pull it on over the head, they actually open up in the front. You can slip your arms in and they close with tiny hidden magnets that you never know. Um, and a lot of this actually started, there's a company called Magna Ready. It was started by someone who was a care partner to a loved one who had early onset Parkinson's and really struggled with buttons. And she said, I don't want to buy stuff that looks like, you know, older folks. Like this is someone who's working and active. I want his clothes to look like his regular clothes. And so she sewed teeny tiny little magnets in and turned it into a business. And they now have things for women and all kinds of clothing. So these are just a couple of websites. Some of them are, so Silverts, for example, has been around for a very, very long time. It tends to be more geared towards folks who really have very, very limited mobility and for someone else to help dress the person. So, for folks who are living in assisted living or skilled nursing facilities, Silverts tends to be where they go. But then there's everything from there to Joe and Bella or Is Adaptive or IZ Adaptive, which are like runway models in adaptive clothing. So it has expanded and is amazing. And I'm sure that there are many, many sites that I'm missing, but check it out. Find things that are easier to wear. And similarly with footwear, right? We have a lot of people that bend down and really struggle to tie their shoes, just the dexterity of it, but also bending down and then sitting up could trigger someone's neurogenic orthostatic hypotension, that drop in blood pressure. So there are a lot of shoes out there now that are hands-free, that you don't have to, bend down and tie and have more support. So they're not just the old slip-ins or loafers that don't offer a lot of support. Um, Different companies, Zeba, Kizik, have a bunch. Skechers has some. And I love this one at the bottom. So this is more on the more expensive end, but just the story behind it. This is the shoe from Nike, and apparently there's someone, a child, who really wanted to wear, basketball shoes, and had cystic fibrosis and really struggled and couldn't put on shoes by themselves. And so Nike took it upon themselves to make a shoe that they could put on. So it looks kind of funky because it's all bent, but once the person slips their foot in and puts pressure down, that shoe goes flat and they
That's
just
great.
need to pull their foot out. So lots of cool stuff out there. Um, I also hear a lot about foot cramps. This can be an off symptom that a lot of people with Parkinson's have. And sometimes this leads to, can you rub my foot? Can you rub my calf? And that can be a wonderful way to connect and, have a nice intimate moment and a moment of connection. But if it's happening a lot and that's something, we want to foster independence for people with Parkinson's, a couple of simple things. This is from our occupational therapist. Go to your local grocery store, get a can of frozen juice concentrate, or you do you, could be frozen daiquiri, right? Enjoy whatever was in there, make it, rinse it out, fill it back up with water, freeze it vertically. Then you have a reusable cylinder that is ice cold. And when the person with Parkinson's has cramps, particularly if they're foot cramps, they can literally roll their foot over that container. You could do the same thing with a tennis ball. You just lose the cold benefit unless you feel like keeping a tennis ball in your freezer. I've had people do it, and then someone opens the freezer and is like, "What is this doing here?" And they lose it. The other thing is at the bottom of the screen, there's this device called Yoga Toes. It kind of looks like you're going for a pedicure, but it's sturdier. It's made out of silicone, and it helps kind of separate the toes. So I've heard about this from some of my people with Parkinson's, and they feel like wearing this for 15 minutes, 30 minutes, kind of before bedtime, or at the times where they tend to get cramps, can be really helpful, kind of preventing them from happening in the first place. So lots
Do you put these in the freezer as well, or no?
I've one of my folks tries. So I
Okay.
think that they keep their yoga toes, but I'd recommend washing between uses before you put the stinky toes back in the freezer. So um, something else that I ask about when I'm asking people about how Parkinson's has affected them is, do you find when you're brushing your teeth that you start off okay on one side, but then it gets more cramped and effortful as you go to the other side of your mouth? And I think 4 to 5 dentists recommend anyways, switching over to an electric toothbrush. It just gives a better clean for everyone. But especially if you struggle with mobility and being able to maneuver a manual brush, in all the ways, switching over to an electric toothbrush can be really helpful for oral hygiene. And this is critical because people with Parkinson's are at a higher risk of tooth decay, of tooth loss, of gingivitis, lots of different things, which then can lead to trouble with eating, with swallowing, with weight loss. So getting ahead of it can be really helpful. Flossing with just manual floss and doing that kind of tug of war thing can be really challenging dexterity wise. And also, if people are struggling with visuospatial processing, looking in the mirror and going, wait, how do I get to that tooth and how do I move my arms? Those little floss picks that are there on the bottom, those can be very helpful instead. And then dry mouth can be a big challenge for people with Parkinson's. It can be related to the disease itself. It can be related sometimes to some of the medications. So simple things to keep the oral cavity wet, or more moist can be helpful. So those top little multicolored things, those are little oral swabs. You just kind of dunk them in some water and kind of swish them around someone's mouth. Those can be very helpful. On the bottom these are a sugar-free hard candy that's made with a particular non-sugar additive that's supposed to be dentist approved, safe for teeth, and help to keep a little bit more moisture in the mouth. So it comes in all kinds of different flavors. Pick your poison, but those can be helpful for folks with dry mouth.
I've heard that they can also be helpful for constipation. And if you take too many sugar-free lifesavers or candies, it can have the opposite effect. Have you heard that?
That is really interesting. And you know what? I haven't thought about it with these, but you are right that some of the additives, particularly I think xylitol, which is what's in ice chips, in big hefty amounts, usually, although some people may be more sensitive, it may be, either a bonus treatment for constipation, or it may cause some excess diarrhea. So, sometimes we'll tell people, not just for dry mouth, but actually if someone has a lot of saliva, and they're having drooling, even though it seems so counterintuitive, we'll recommend that people suck on sugar-free sour candies or chew sugarless gum. And the reason being that will actually make you make more saliva, but it reminds your brain that that's happening. And so you swallow more often. So you're making a little bit more, but you're swallowing this much more. But sometimes those sugar-free candies or that gum has xylitol in it. So just be mindful if you notice some belly issues. And then this is something, I think was a really cool, it like won an award as kind of a brilliant invention. And we don't really see lots of inventions specifically designed for care partners. But if you think about shaving yourself, shaving someone else, razors are largely designed for the person holding it to be shaving themselves. And you use different hand positioning if you're trying to shave someone else. And that can be really challenging. And so this top left, the Gillette Trio, is a self-contained razor that was specifically designed to help a person shave someone else. And the blue squishiness, it's kind of like a toothpaste tube. it actually has like shave gel in it that you don't need water for. So it's kind of all self-contained, all in one. I've had some folks who really like it. I've had other folks that are like, meh, don't love it, but it's out there. So to know that if you're feeling like you're struggling, trying to help someone shave, you're not alone because it's not designed to do that. Um, and the alternative is sometimes, a lot of our men will still be shaving with manual razors. And that can get more dangerous as Parkinson's goes on. So, gently encouraging a switch, which can be a big mindset, this can be a hurdle, but switching from a manual razor over to an electric razor can really prevent a lot of nicks and cuts and bleeding, and maybe a way for the person with Parkinson's to have more independence with their grooming rather than the care partner having to help them. Um, and then similarly, at the bottom, the lady who's smiling, she's washing her face and she's using one of these little facial massager things. So sometimes people have a hard time, just washing their face, or we may have folks with seborrheic dermatitis, which is that itchy, scaly, kind of peeling skin that can go around the eyebrows, kind of in the folds around the nose. And sometimes using, a gentle shampoo and being able to really exfoliate and scrub can help. So something like this does the work rather than the person having to struggle with a washcloth or the care partner having to struggle. Um, and then I heard about this, for a lot of folks who wear makeup and have Parkinson's, they may find that it's really hard to put on the eyeliner the same way that they used to, or to use mascara. And there is a makeup artist, actually, who had a neurologic illness, and she designed her own set of tools to accommodate and make it easier for her to apply makeup to herself and to others. And so then she, put those out on the market. And so, just really simple things can make a big difference and let the person with Parkinson's do for themselves for longer and, be proud of that.
Yes.
We talk a lot in our clinic about where do people fall? And one of the most common places that people fall for a number of reasons is in the shower or getting in and out of the shower. Um, for lots of reasons. It's a cramped, tight space. So people who have freezing of gait, their feet get stuck and they could fall. For people who have neurogenic orthostatic hypotension, a really hot shower can kind of drop blood pressure for a lot of people, and standing up for a really long time can drop blood pressure for a lot of people. And so it can be a really kind of danger zone. So I've done hundreds of home visits, and as many people will tell me, like, no, I can't do a shower chair, or like, there's nothing that will fit in our tub. I promise there is something that will fit in your shower or your tub. And these can be really helpful, right? Better to have something and sit if you need it than to not have something there. And most showers that may have a little bit of a ledge might not be enough for someone with Parkinson's to feel safe. So there are ones that fold up. There, just make sure that it is, not going to slide around in the shower. And then at the bottom of this, these are shower benches or tub transfers, which are really brilliant. So if you have sort of that combo bathtub shower, having someone with Parkinson's swing their leg all the way over can be really hard. And so this is something that, depending on the setup, they can basically sit down on the bench outside of the tub and then just scoot from one side. You may have to help pick up their legs, but you're not having to bear all of their weight or hold them or hoist them as they go over in the tub. And this way they're sitting in the tub, they can be bathed, probably more hygienic than, constant sort of bed baths and things like that, and gives them a little bit more independence. And as I mentioned, like, freezing of gait is a really difficult thing, and also slippery floors are really concerning. So our physical therapists often tell people visual cues can help overcome the freezing. And so getting non-skid tape or non-skid stickers. So I've got little kids. We've got, various different stickers on the bottom of our bathtub. Again, make it yours, right? So if you want to get the handles on the wheelchair and you want to have streamers and glitter, you do you. But brightly colored non-skid tape can help remind the person with Parkinson's, step over, take those big steps, aim for this. And Similarly, that can help with stairs as well, or other tight, cramped quarters. Instead of thinking, I'm stuck, I can't walk, I'm stuck, I can't walk, it's almost picking up the needle on the record player out of that groove that they're stuck in and going, I'm going to go put my heel on that yellow stripe. And that is a different program for the brain to think about and actually will help get the person out of the freeze. All right, we talk so much about toileting in clinic. And it's not comfortable for lots of people to talk about the bathroom. It usually we think about it as off limits, but there's so much in Parkinson's that can affect bathroom habits. So urinary issues, people with Parkinson's, especially our women, have higher rates of urinary tract infection. And this can be for lots of different reasons, but one of the things that we think may be going on is that it's just harder to wipe. If we're being honest, if someone has rigidity, if their shoulder is stiff and they have to reach around, it can just be more difficult. And people may not have, full sensation of whether, they're sort of complete or not. And so something that may be helpful is actually a bidet. And you don't have to go full European. No shade to our friends and colleagues in Europe, but there are add-ons to regular standard toilets in the US that you can order them. You can connect it to your plumbing lines. Many of these are pretty straightforward, and you can set up a bidet. And actually, that instead of just wiping with toilet paper, may be really, really helpful for folks. Constipation is a huge issue. So the bidet can be helpful for that. But also, we also know that folks who use more of a squatting position when they're having a bowel movement, it's easier and there's less strain than folks who are sitting regularly. This does not mean that you should hover over your toilet or you should be squatting. What this means is you should sit comfortably on your toilet. And if we just raise your feet up so that the angle of your hips is different, that changes the angle of the muscles in the pelvic floor and lets the muscles that need to squeeze and the muscles that need to relax do their jobs better. So that second photo, the squatty potty, there are plenty of other unbranded versions of that, but any step stool that fits around or near the toilet that you can have your person with Parkinson's put their feet up on and that has non-skid bottoms. That is really the key. Is we do not want it to be a fall risk. We want it to be something that helps them. And just for folks who have constipation for any other reason, also bonus can be really helpful. It can be really hard to get up off of a toilet seat. Again, we get back to that low seats, low car seats and things. This applies to the toilet too. There are different toilet seats that can go on top of your toilet seat to raise it up, make it easier to stand up. The one thing I will say, I did not know this. This is not part of neurology training. You need to know the shape of your toilet seat. This may seem obvious to you, but there are more round seats and there are more oval seats. Before you order a raised toilet seat to go on top, identify your shape and order accordingly. And then often people may have to go to the bathroom really frequently. It may be really hard to move around. So having a bedside commode can be not an ideal alternative, but it may be a safer alternative for a lot of people rather than getting up and having to go quite some distance when mobility is a challenge. There are various different ones. If you are someone who's tall, they make taller bedside commodes, they make shorter bedside commodes. So again, find the one that works best for you. And for folks who wake up and need to go to the restroom in the middle of the night, please, please, please think about getting night lights. The time when people fall the most is getting to and from and in the bathroom in the middle of the night. If we can have it better lit, that takes away one variable and makes the chance of falls much less. So motion detecting night lights can be plugged in all along the way. This means that if you are their bed partner, you're not necessarily woken up by someone flipping the lights on, and hopefully you're not woken up by them falling in the bathroom. And then just continuing on the theme of toileting. For men, I would say, unfortunately, this is a lot easier for our male folks with Parkinson's who struggle with getting up and back to the bathroom. There are a lot of different devices that can help them in terms of portable urinals. There are the jugs that you might be familiar with if you've seen one in a hospital. They kind of look like a weird milk jug. They can sit on a bedside table. They don't always have the best, most secure covers. So, eh. There are various different portable urinals, though, that are available on all the different sites. They all work a little bit differently. Choose your own adventure, but know that they are out there. And if, especially if someone is waking really frequently, struggles to get to the bathroom, there isn't room for a bedside commode, or they want to do it independently, a portable urinal is a much safer option than that person waking up a bunch of times and struggling to the bathroom on their own, or waking up their bed partner, their care partner, who then has really disrupted sleep themselves and is already setting themselves, kind of up for a really rough day the next day if they haven't gotten sleep. So no one loves a portable urinal, but it may help with things. And then this quick change is really for folks who struggle more with incontinence and may not get the signal that they need to go to the bathroom, but is a quicker change than like an adult incontinence garment or a diaper. But those can be really helpful. And that can be a big struggle for someone to accept. But I often frame this for folks as think of this as an insurance policy, right? And if the investment is a person wears, one of those, a Depends or something like that every day for 7 days, and they are pristine and dry, 6 out of 7 days, but that one day they needed it and they were out at a restaurant or they were out at a family gathering and it served its purpose, it's probably worth it. For a very long time, we had nothing for our women. Just the anatomy and the physics make it a little bit more difficult to have portable urinals. I am not endorsing any of these or saying that any of them are perfect. These are really more designed for women out camping in the woods who might want a urinal. But I have had some of my folks successfully use these in certain situations for women with Parkinson's. So we, technology is lagging behind, ladies, but
Clearly, as is marketing the names.
yeah,
Sheely.
yeah. Mm-hmm.
All right, let's talk about medication and adherence and why this is such a crucial part of living well with Parkinson's and the care partner's role.
Yeah. So, I think this is something that in medicine, I will say we often take for granted because we know, or many healthcare professionals know, that medication adherence, which is really the preferred term, is how well does the person, who needs to take the medicine understand, agree with, and take it the way that we agreed that they would take it. Not that we told them to take it, right? But that we came to an agreement and they said, okay, I'm going to do this. And we know that medication adherence is low for a lot of things, right? And in movement disorders in the Parkinson's world, we kind of say to ourselves, well, this is not going to apply to my folks that I take care of because, well, sure, if someone needs to take a cholesterol pill, they take the pill and they don't feel anything gets better, right? So it's easy to forget or not really prioritize that. Cholesterol pills are still important. But in Parkinson's, for example, if someone, is sensitive, has ons and offs, feels their levodopa or their meds kick in, right? They take their pill, they feel better. Well, then clearly they're always going to take their pill on time every time, no matter how many pills that is or how many times a day. That's not normal human behavior. Okay? Like, let's just be honest here. We know that that's not perfect and that no one is perfect at taking their schedule. Okay. And it's really important to be honest with your healthcare professional and really tell them, listen, I know I'm supposed to be taking this 3 times a day, but I got to be honest with you, 4 out of 5, times, like I'm probably missing the middle of the day dose, right? Because for a lot of people with Parkinson's who are busy, they're on the go, which we want them to be. Stopping in the middle of the workday or a hobby or playing pickleball or whatever it is to, check your watch, stop, go get some water and take a pill is not convenient at all. And so telling the healthcare provider, listen, I'm having a lot of off time at 3 o'clock, but I'm actually not usually taking my 2 p.m. dose. Okay, let's work around that. Versus if I think that you are taking your 2 p.m. dose and you're off at 3 o'clock, I'm going to increase the dose of your meds, or I'm going to add something else, or I might take away something that's actually working because I think it's not based on what you're telling me. So that open communication is number one. And then finding ways to take the medication as close to that schedule as possible is really important. So some key things for medication adherence are, if possible, linking each dose with a regular activity. If you always brush your teeth at the same time, maybe keeping your morning pills by your toothbrush, right? Or if you always make the coffee or you always read the paper, or you sit in a specific chair in the morning, maybe that's where things go. Or setting reminders. And I'm a sticky note person. So if you need to, pop sticky notes somewhere that says, did you take this? That works. Sticky notes fall off though. What might be better are various different, setting your phone alarm. Or the problem with phone alarms is they're great, but I see a lot of people, their phone alarm goes off in the middle of the visit and they're like, okay, we'll do this on the way out. And they snooze it or they just turn it off, right? Or you're just not in the same room as the pills. So we'll get to it later. But a lot of people don't get to it later, right? So there are now a lot of pill boxes that are self-contained pill boxes with alarm. So the pills are in the same place as the alarm. It goes with you wherever you go. A lot of these can fit in a pocket. There are some that are like the size of your palm. And many of them have multiple containers or multiple compartments. So you could set up to 4 or 5 different times in a day. Those can be really helpful. I mentioned the phone alarms. So most cell phones, including flip phones, I have folks and they're like, I don't have a smartphone, I have a dumb phone. I'm like, your dumb phone can still do this, I promise. Um, so they can handle at least 3 alarms daily. Many can do more. You can add the medication name as the label so that you know or your loved one knows this is what I'm supposed to take right now. Um, and you can use different ringtones so that it's easier for someone who might have trouble with processing. Like, oh, that ring is a pill alarm, whereas, this is my get up in the morning or this is my phone alarm. And then there are a ton of different apps. I don't know that any of them are better than any others, but there are lots of different apps that you can plug all of the medications into and it can help set up the schedule. And just kind of a note of levity when traveling. Please, please, please never pack your medications in your checked baggage. That is somehow a subliminal message to TSA to lose your bag. Okay. Just if you put your meds, especially if it's something that's difficult to get and you're going away on a long vacation and you're crossing country lines, they will lose it if you put your medicines in your bag. So for all of the reasons, always keep your medications with you in your carry-on bag. It is worth paying for another bag if you need to not have your meds lost. If you are traveling outside of your country, know that different Parkinson's medications may not be available where you're going. So please make sure that you're bringing enough with you for the length of your stay and maybe an extra day or two more just in case of emergency. If you're going to the hospital for any reason, please bring your medication list, your most up-to-date medication list, including any vitamins, supplements, over-the-counters, cough, cold medicines you might have recently been taking, any of it. And if you take any hard-to-get Parkinson's medications, bring them with you because your hospital may not have them on formulary. And they may either switch you to something that they do have, but it won't be perfect, or you may just be missing it. But instead, they will usually take it from you, label it, and say, this is Joe Smith's whatever. They will keep it and administer it to you, and then make sure that you get it back when you are discharged from the hospital.
All right, the last topic for today is your tips around food preparation, eating, and hydration.
Yes. So many different ways that we can make sure that people are not just getting in their nutrition, which is critical, but are able to enjoy their meals, right? This is not just as a care partner. Sometimes we worry about, have we cut things up enough? Is this prepared the right way? Are they getting the right nutrients? Yes, but we want people to be able to eat and drink as independently as they can for as long as they can and enjoy it. So sometimes people have a hard time with neck rigidity. They may have a really hard time bending their neck down or tipping their head back to take a drink, right? Mm-hmm. If you can't tip your head back, that's really, really hard to take a drink out of something because then you bonk your nose into a cup. Someone very brilliantly took a plastic cup and cut a triangle out of it. They cut a nose window out of a plastic cup and probably made millions. Okay. So this is called the nosy cup. There are many different varieties and colors and sizes and things, but if your loved one struggles with tipping their head backward or forward, easy fix. If you've got a drill in your house or a saw that you can do that with, do it yourself. It's fine. For tremor, weighted utensils can be really helpful. They're not perfect at dampening a tremor, but they may be useful for someone who really struggles with soup or things like that, to kind of quiet the tremor just a little bit. Weighted utensils used to be really ugly looking and really obvious. There are nicer ones out there now. I have folks that sometimes will bring them to a restaurant. So it's easier and a person feels more comfortable with the utensils they're used to at a restaurant. Just make sure you don't lose them at the restaurant. Um, the other is that it can be hard. Sometimes the plate can get away from someone with Parkinson's. They might be sort of trying to scrape their food towards one side and they're kind of chasing the plate. A silicone placemat can help keep the plate in place. And I love the graphic because in this graphic with the corn cob, there's a little bit of a lip on that plate. So a lip or rim to the edge gives the person with Parkinson's something to kind of scoop up against and a little bit more leverage to be able to pick up their food. And then I had a brilliant care partner who said, I couldn't keep watching my loved one struggle with a knife and a fork, right? And cutting up a tough piece of meat or, trying to cut through something really hard is actually something we ask for on like one of the Parkinson scales. She said, I took away the fork or I took away the knife and I gave my loved one their fork to pin something down and one of these pizza cutters instead of a knife. And it works brilliantly. There are lots of different pizza cutters out there, or there are these mezzalunas or rocking knives that just kind of look like a blade. And you just kind of go like this. It's great for making pesto, also really great for things like this. So there's that example of a rimmed plate. That looks beautiful. You might put some fruit in there, but anything that's got a lip will help. Opening cans, opening jars. There are all kinds of different ones out there. There's a really nice one that has like a V shape that kind of works for lots of different jars and sizes. This can help someone who struggles with Parkinson's, but also struggles with arthritis to open things up. And this one touch opener is magic. You just press the button and it like works its way around the can like a little can opening robot. There are all kinds of different versions, but take the struggle out of things so that the person can really enjoy everything else. All right, staying hydrated. This is a really, really important thing. The more hydrated a person is, the better their constipation, the better their medications are absorbed, the better their fatigue, the better their mood, the better their blood pressure control, right? So lots of obvious reasons why staying hydrated is important. And it can be really hard for people with Parkinson's to stay adequately hydrated. A lot of people just don't like water, just won't drink plain water. That's okay. Um, Anything that is decaffeinated counts. And this doesn't mean we're taking away caffeine from people. This means that caffeine just acts like a diuretic. So imagine if you drink 8 ounces of coffee, you're going to pee out 10 ounces. So doesn't mean we take away their caffeine, just means we need to make sure that we're kind of keeping pace, right? But hot or iced decaffeinated tea or coffee, you can throw some fruit slices or mint into a bottle of water. There are all kinds of fancy water bottles that will do that for you, but you can add in any flavorings, Crystal Light, Mio, just there's 1,000 different brands. Go crazy, buy a spectrum of different flavors, see what your loved one likes. All of those are really hydrating. And our dietitian, Kristen, always tells people, she goes, you can eat your water. And I was like, she's finally lost it. What she means is there are so many foods that are 90+% water. So particularly fruit. All the fruit except bananas are largely water. So if your loved one won't drink, but they will have a big slice of cantaloupe or a great peach in season, do it. It counts. Soup counts. Milk counts. Anything counts towards it. Even decaffeinated sodas count. So hydrate, hydrate, hydrate. It will help with all of the things. And finding a water bottle that the person with Parkinson's likes, that they can carry, so the care partner doesn't have to lug it around. And that may depend on the size and the shape and whether they want a straw or whether they want a hole or what, how it opens and whether that's easy or difficult. You may have to kiss a lot of water bottle frogs before you find your prince or princess or non-binary royalty water bottle. But it's out there. If you have kids or grandkids, they likely have a bunch of water bottles lying around. You can test out which ones the person with Parkinson's likes and finds easy to use. Go with that.
Wow, we have gotten through so much content here today, Jori. I'm going to stop sharing my screen, and we're going to close out this session with a couple of notes for everybody in the audience. One, first is thank you. Thank you to Dr. Fleisher, to Jori Fleisher, for joining us today. For you in the audience for being here, for caring enough to want to take some action towards improving your own quality of life and that of your loved one. And if you like this content and you'd like to get more of it, Jori and I spent 10, 12 hours, more than that, together a year ago. And we have recorded with a live audience, and it's captured topics that are really important for you as a care partner. And Jori, do you remember what some of those topics were?
Oh my gosh. We covered everything from, constipation and orthostatic hypotension and various different Parkinson's symptoms that you might struggle to understand and get good resources about, but also to coping with changing relationships and guilt or strain, or what does self-care look like when you feel like there just is no time, and how am I supposed to put my oxygen mask on myself before I put it on someone else, right? All of that. We got a lot in there.
So there's so much there for you. And if you haven't checked that out, we'll provide a link for you all. And we'll have a few more this year for you to check into. So in the meantime, if anything here today spurred some ideas for you in the audience, or you have an idea to share with us of a tip or a trick that you use that's particularly helpful that you'd like others to know about, email us at carepartners@dpf.org. That's carepartners@davisphinneyfoundation.org. We'll share that with Dr. Fleisher so she can add it to our list, and we'll also share it back with all of you. Thank you for being here today. Be well, and we'll be back with you soon.